What's going on, everybody? Welcome back to my channel. In today's video, we're going to be looking at exercises for Iliopsoas or hip flexor tendon pain. So if you've got pain on the front of your hip, maybe your hip clicks or has pain when you're running, going upstairs, or walking, then this will be the video for you. If you're new to my channel, my name's Dr. Tom Walters and I'm an orthopedic physical therapist. Again, in today's video, we're talking about Iliopsoas tendinopathy, which really just means dysfunction and pain of the iliopsoas tendon. The iliopsoas muscle is our primary hip flexor. It's the muscle that brings our hip up into flexion. These muscles, this muscle group is really made up of two muscles. One is called psoas major. It attaches on our low back, on our lumbar spine. And the other muscle is iliacus, which is on the inside of the ilium here, this bone of the pelvis. The two muscles join together and come down and attach right here on the inside of the femur on this bone here called the lesser trochanter. So like I said at the beginning of the video, people will usually have pain here right at the front of their hip, kind of near their groin. They might also feel kind of a popping or clicking right here because sometimes the hip flexor tendon can pop back and forth over this bony prominence, the lesser trochanter. So if you've got clicking and popping in that region, or you have pain with activities where you're using hip flexors, which is usually running, going upstairs, maybe even walking, then the exercises I'm going to show in this video can help reduce pain. For the first exercise, we're going to perform an isometric contraction. Isometrics are really great for helping to reduce tendon pain in the early stages of rehab. Basically, the exercises in this video are going to get more challenging as we go along. So if your symptoms are more acute and intense right now, you might just start with the isometric only. For this, you can do it sitting. You could also do it lying on your back. I'll show both versions, but if we're sitting, I'm going to pretend like my right leg has the symptoms. What I'm going to do here is lift, my hip flexors again, lift my hip into flexion, and I'm going to use my hand to create resistance. So I'm just doing an isometric. I'm pushing with the appropriate resistance. You want it to be a strong resistance, but you don't want your pain to be more than mild/moderate, so no more than 3 or 4 out of 10. So I'm just pushing as strongly as I can, and then my hip flexors are trying to push up, so they're resisting. My arm would push down if I don't overcome that resistance. So I'm just going to sit here and hold it. With isometric contractions, typically we'll have people do 4 to 5 reps every day and hold each one for 30 to 45 seconds. And again, these can be really helpful for reducing acute tendon pain. So you can do it seated like this. You could also do it lying down. So if you'd rather be lying down, maybe it feels better. Sometimes this feels better when you're starting out. You can lie on your back, straighten the other leg, and then again, just push and create an isometric here. Just holding in that position. So same type of idea, 4 to 5 reps every day, hold for 30 to 45 seconds. Just pick which one works better for you, either the one lying down or the one in the seated position. That's our first exercise, the hip flexor isometric. The second exercise will also be isometric in nature, but it's going to be a little bit more dynamic, and it's also going to incorporate our core muscles, especially our abdominals. When we're working on hip flexor rehab, it's also good to incorporate our core exercises. So you're going to do a front plank with this. Now you could just start out in a regular front plank. Again, say your pain is a little more severe. Maybe just start here and test this. But then what we want to do is slowly work towards an alternating kind of front plank where our weight is on one leg and then the other. So if my right leg has the symptoms, when I lift my left leg, all the weight will be on my right leg, and it will really challenge and work those right hip flexors and my core. And I'm just going to go back and forth and maybe try to hold for 10 seconds on each leg. You can kind of play with this and see what works best for you. No real firm formula on this, but just going back and forth. You can even just hold 2 to 3 seconds and just alternate back and forth. And again, you're working in an isometric fashion, but because you have to shift from leg to leg and it incorporates your core muscles, this would be kind of a progression from our first exercise where we were just doing an isolated isometric contraction. Okay, so that's our second exercise. That's sort of alternating or marching front plank. Give that one a try. All right, here's the last exercise. This one will be the most challenging and really the most functional. You're going to use a loop band for this one. I'll put a link for a set of these down in the description box if you need to get some. You're going to put this around sort of your, kind of like your midfoot, and you can hold on for balance if you need to, but if you can not hold on over time, that would be ideal. So what I'm going to do here is if my right leg has the symptoms, I'm going to lift that leg into hip flexion, and you can see I have to overcome the resistance of the band. I'm going to hold at the top for a second and then slowly go through a slow eccentric back down. And then I'm going to repeat like that. So I'm just going to do somewhere in the neighborhood of 3 sets of 10 to 15 repetitions of this. This is an exercise I would try to do every day. If it flares you up, then you could switch to every other day. You could do all of the exercises in this video if your pain is calming down and you want to create a little program. You could do all 3. The isometric, if it gets to be easy, then maybe just do the front plank and this banded hip flexor march as your workout. But because this one's more of a traditional strengthening exercise where we're going through full range of motion, like I say, I'd go for 3 sets of 10 to 15 repetitions. Basically just go until you're tired. You could work up to 20 to 25 repetitions if you need to. If you buy a set of bands like this, they'll come in different resistance levels, so you can always just go to a more challenging band if something like this green one's pretty easy. So that is our last exercise, the banded hip flexor march. Thanks for checking out today's video. I hope you find these 3 exercises to be helpful. Also, just want to mention again that my book is available on Amazon and Barnes & Noble. It has comprehensive rehab programs for the entire body and all of the most common conditions. If we go back to the hip chapter, we'll see here on page 354 that there is this dedicated hip flexor pain program. It shows the anatomy I was talking about with the psoas major muscle and the iliacus going down to the lesser trochanter. The programs in my book will all take you through 3 phases and have pictures of me doing the exercises. They progress kind of like a physical therapy program you'd get from me if you came to see me in the clinic. So really just a more comprehensive program. And again, each body region has its own chapter. I'll put an Amazon link down in the description box if you'd like to get a copy of the book. Again, thanks for checking out today's video. I'll see you in the next one. Bye.